Frost 19 is our unit that we have designated to take care of COVID patients. We have chosen a place that's separate from the general population so that we keep the general population of the hospital safe. And it also allows us a place to take care of our COVID patients that, like I said, is isolated. No, there's a different group of staff members that take care of COVID-19 patients. We are actually considered the superhero team. We all electively signed up to be a member of the superhero team, as they call it, and so that way we were taken out of the general population. We only serve the COVID-19 patients. The most interesting aspect of the COVID-19 unit that we have is that we implemented this thing called team nursing. The dynamic of it is that we have an acute care or an intensive care nurse who works alongside an intermediate nurse, and then we also have a tech that's on our team. The idea that implementing this team nursing has created is you have to work together. And for me, it's been a rewarding experience and something I think that is going to be really, really phenomenal moving forward in the way that nursing is shaped possibly in the future. I never really had any fears going into the COVID-19 unit taking care of the patients. I think my fear was more my family had the fear. So I'm going to be safe, Mom. Don't worry. I'll call you every night after shift and it'll be okay, Mom. We've got the right PPE. And that was the biggest component, I think, of me feeling safe, was the fact that our hospital did have all of the protective equipment that we needed to stay safe. I think my fear would have started had we run out of the PPE, like you hear happened a lot in New York City, but we never did. Our hospital management was very great in making sure that we delegated the PPE appropriately, and because we had that available, I felt safe. We had a patient, he was actually our first patient to get intubated, which means being put on the breathing machine, and that was COVID-19 positive. He had been in our unit for about 40 days now, and just to kind of give a little bit of perspective, for every day that a patient is in the hospital bed, it takes 3 days worth of rehabilitation to get back to baseline. So we knew that we'd have to send him to a long-term care facility for that rehabilitation. For that, however, he had to have two negative COVID tests. He'd already had one negative COVID test, and if we tested positive on the one that I was going to take, then that meant this poor man had to stay with us for another week. So I was really nervous, almost like taking the SATs all over again. I hope I pass this test. And so I swabbed the patient to see if he was negative. His results came back later that afternoon, and I just remember saying, "He's negative!" And then the whole unit, I didn't even realize they were listening to me, but maybe I yelled it that loud. The whole unit erupted in like cheers and laughter and, just an applause, almost as if we were at like a football game or something. And they were all excited, and they're like, "You hear that? You're getting out, you're getting out." We make sure that we take every precaution necessary to keep the people that are at the most risk separate from the people who are a potential risk. And even in transporting our patients who do end up being COVID positive, transporting them to our COVID unit, we have a special process that everybody from security to our ambassadors to nursing staff to our COVID staff, our managers, everybody, we just make sure that we follow that process every single time. I keep referring to it as a well-oiled machine, and I can't really describe it any other way. I mean, we just work so perfectly and so cohesively together that it's really inspiring. This is what we do. This is our job, is to take the public's health and they put that in our hands, and we know that. We know that they trust us with their health. And so we just want them to know that we're doing everything that we can to keep them healthy and to keep them safe and to make sure that we get through this all together.